Oh, wait, I got a thing. It said recording and transcription. So it's recording now?
Yes, I believe so.
Okay.
Hold on, give me a second.
Oh, yeah, I see it. Just, you want me to start?
Hold on one second. Are
Okay.
we okay? Are we recording?
Yes, we are.
I want to make sure before we actually start, but we do it, and we're okay. Okay, we're recording, so we can start.
Well, hello. Today we have a presentation on HIV across the lifespan for class 7100 pathophysiology, presented by
Jennifer Betts.
Jalen Bird.
April Eldridge.
Akia Tatum.
Okay, so I'm going to start off. I'm April, and today we're going to talk about HIV. And we have an interesting case study, but first I'm going to let you know what HIV is. Excuse me. HIV is a virus that directly affects the immune system. And in the process, it alters the CD4 and T cells of the body of an individual, and those cells help fight the disease off. Excuse me. This presentation that we are struggled to get with and come together is a very unique presentation because the case study that we're going to present in a second will show you why it's so unique. A true life story. So HIV, it defines the main features of the disease, and we're going to talk about the etiology, the pathophysiology, clinical diagnostics, treatments, and more things that can help a person if they're going through this, or maybe they know someone who may be going through this. Moreover, the perception of the vertical transmission from the case study that we have from the mother to child is discussed with reference to a real case, and that we're going to talk about. HIV stands for human immunodeficiency virus. The virus, it is a disease that back in the 80s, people thought that if you even touch somebody with HIV, that you'll get it. Because back then in the 80s, they didn't have much knowledge about it. So first it becomes HIV, and then after that, it develops to AIDS. And AIDS is the ending part of it. So like I'm going to tell you in a case study that I'm going to talk about, I can show how it progressed and what happened. So you'll see that through this case study. You can get it, HIV, from sexual activities, blood products, sharing needles and equipment, and directly from the mother to the baby while she's pregnant. You can also get it during the delivery and breastfeeding. So that's what we're going to talk about now. So the case study, first, it was about my mom. My mother had HIV back in their mid 80s. And she was about 36 years old. She wasn't a drug user. So she probably got it from sex or maybe even a blood transfusion. I don't even know. I know she had a couple blood transfusions, but I know she wasn't an intravenous drug user or anything like that. So it probably came from sex or a blood transfusion. We still don't know to this day, but she did get pregnant. So back then, when she became pregnant, she didn't know she had it at first. and she got tested, was diagnosed with HIV. And not only did she get diagnosed, a few of my friends' mothers were diagnosed back with it because it was like in the neighborhood that we came from. So I'm pretty sure my mom had Medicaid. We didn't have good insurance. And so her treatment options were very slim. Um, so she became pregnant. She had my brother. She contracted pneumonia and she couldn't fight it off. So that's what eventually killed her, the pneumonia. So when she died, she had my brother. He lived, but he is also living to this day with HIV, and his CD4 count is good, and he is undetectable. So they didn't have the medications that they have now, which is the antiretroviral therapy, and it wasn't available to my mom, and so that's how my brother ended up catching it, and he's still living with it to this day. So if you don't take your well, some people I know, my friends brother, he has HIV. He's had it for maybe like 15 years. And he does trial therapies on different medications, and they are ART meds. And what he does is he does trial and errors. So he gets free medications, and the medications that he gets actually is giving him a chance at life. He's healthy, he runs marathons, and he pretty much is living with it now as just like my brother, because the therapy that they have now, they didn't have it back then. So back to my brother, he's healthy. He's 36 years old, and he was able to live a healthy life after my mom died with ART. So with AIDS, AIDS is transmitted by a retrovirus that infects the immune system, and most especially the CD4 and T cells. When a person can't fight off, just say like my mom, a simple cold that she had, which turned into pneumonia, and her immune system was so low and weak that she could not fight it off, then she passed. Because I was looking at her death certificate maybe like 3 weeks ago, and it didn't say HIV or AIDS. It said she passed of pneumonia. So with having that HIV, AIDS, you get something else, and that is, if that's what they put on her death certificate, they put pneumonia, but it came from HIV and then the AIDS progression. So for the prevention and control of HIV and the management that it burdens our community, there are treatments and other things like that where people can live a healthy life with HIV and AIDS, if they do the right thing, and with the advancement of medications. And I'm gonna let Akia talk about that.
I'm going to talk about the pathophysiology of HIV. HIV is divided into three main stages. First, you're going to have your first stage is going to involve the virus, which causes flu-like symptoms. Those symptoms may last for 2 to 4 weeks of the exposure. After that, you go to the asymptomatic stage, which may last for years. And it is a gradual immune suppression. The virus and its effects on the immune system progresses through the destruction of the CD4 and T cell. HIV, if left untreated, causes AIDS, which is the advanced stage of the virus that significantly weakens the person's immune systems, thus increases their susceptibility to other disease and cancers. A normal CD4 and T cell count in a person that has HIV is between 500 and 1500. Next, I'm going to talk about the clinical manifestation, which like I said, the early symptoms includes fever, fatigue, sore throat, rash, and swollen left nose. And then it progressed to chronic diarrhea, night sweats, and recurrent infection, and then to AIDS defining illness, which includes your compulsive sarcoma, tuberculosis, and other opportunistic fungal infections. The expression of HIV in subjects depend on the clinical stage that can be different in after about 5 days of contact with a person, infected person, early signs of the disease, like I said, include the fever, rash, and swollen glands. Testing for HIV requires some procedures to establish an HIV positive status besides evaluating the prognosis of the disease. We can detect HIV by doing a blood test, and it shows you whether you have the antibody or the antigen, which is the ELISA rapid testing or the nucleic acid testing, which tests for the viral RNA. We can monitor the person's CD4 and T cell counts or their viral load tests to assess the disease progression. Treatment options includes antiretroviral therapy, which suppresses viral replication, preventing disease progression, and a combination therapy to avoid resistance. Back in the day, you used to have to take all these pills for the antiretroviral therapy, but now it has been decreased to one single pill regimen, and also long-acting injectables. Improved access in developing countries have determined what the art is. Case studies relevance, the sun survival highlights the life-saving impact of the art therapy. Okay. Similarities between the case study and current research shows that the antiretroviral therapy enhances life expectancies and life quality of the client's diagnosis with HIV. Initiation of the ART and early diagnosis, according to evidence, helps a stagnation of the disease progression and transmission, with special emphasis to mother to child transmission. It is with this in mind that the survival of the son to ART advocacy, which supports research that finds that adherence to the ART can turn HIV into a chronic disease. The case study shows several inconsistencies with literature research. This, however, can be attributed to the fact that HIV care back in the 1980s was limited. The mother also, unfortunately, never had access to diagnostic tools or possible treatment such as art, which regrettably were not available early. This gap explains some of the inequity in accessing healthcare in the past. The son got to receive better treatment due to newer forms of treatments. The mother quality represents the outcome of health inequity. These disparities underscore the importance of similar access to as well as proper diagnostic tools, early phases of the management. Holistic care in HIV management addresses the mental health concerns such as depression, anxiety. We need to provide nutritional support for immunocompromised patients. We need to integrate family-centered care to support affected individuals, and we need to provide a lack there may be a lack of holistic care options in the 1980s that may have contributed to the to the mother's poor outcome. I'm gonna pass it on to Jayla now.
Okay. So I'm going to talk about the cultural composites in HIV care. So the stigma and discrimination reduces treatment adherence. So as far as us becoming healthcare providers, we must understand the uniqueness of each individual affected by HIV and AIDS, and also the challenges that they may face. This will help and improve their health, and also builds trust and encourage engagement. So that way we can educate them about their disease. So some things that we can do as healthcare providers to show cultural competency, because HIV does remain a public health issue, is we can talk about their cultural beliefs, practices, use gender affirming language, spread the word to them so that way they can spread the word to others about preventative measures and those in the particular communities. A fun fact that I did find out was after sexual intercourse with someone that is HIV positive, the individual that's not HIV positive, that individual can be infected for 6 to 14 months, and still have a seronegative test. There's also a case study that highlights the mother to child transmission of HIV, how they limited that. So what they did was they just improved the art therapy for the mother, so that way it limits the exposure to the infant. So moving along, we do have preventive strategies. So there is an organization, the United Nations AIDS and HIV, and what they do is they actually um, find ways to advance the preventative measures of HIV disease, and also help manage it. So they target diagnosing, treatments, and viral suppression. Also, what we also can do, like stated before, maternity art therapy to decrease the risk of exposure to the child, like the case study we talked about previously with April. Um, and also just practicing safe sex, educating patients about not sharing needles, and also just talking to your partner about your status. Moving along, we have the challenges in HIV management. So what are some of the challenges that these patients face? So sometimes they have a fear of being seen in the HIV clinic because they have this stigma or discrimination because they have this HIV. Because like stated before in April's case study, if you just touched, if back in the day, if you were to just be around somebody, they thought that you would catch it. But that's no longer the case anymore. Right now, some of the challenges is just the access. It's particularly talking about financial lack of insurance and just limited healthcare facilities that specialize in HIV. So, with the expansion of telemedicine, that can take away some of the challenges and the burdens that these patients may face. So, I'm actually moving along to Jennifer, and she's going to close us out.
Impact on future practice. In view of these bases, HIV has key implications for the future of practice, especially from the aspect of prevention, early detection, and patient-centered care. It is important for healthcare workers to teach HIV prevention and demand AIDS tests and compliance with ART. Healthcare imparity is a critical issue in the modern world, and using the case presented in this presentation, it becomes apparent that such issues need to be addressed. Client-centered and culturally sensitive knowledge can show enhanced patient health benefits and level of existence. It is therefore vital that practicing clinicians remain up to date on the progressive treatments and technologies becoming available in the management of the HIV disease. Future research directions. In future HIV research, the following need to be addressed: HIV vaccine and eradication of HIV latent sources. Such recent discoveries of genetic engineering as CRISPR may have a potential of eradicating HIV from patients. Also, it is important to know the outcome of ART with respect to long-term quality of life. More knowledge about socioeconomic factors of HIV care delivery can strengthen global initiatives seeking to provide access to care equitably. Innovations may turn AIDS to a treatable and/or curable illness, changing the very meaning of public health. Recommendations for improvements. To enhance HIV care, the following recommendations should be made. All diagnostics need to be possible with point-of-care testing, especially with poor nations gaining the capability to perform diagnostics within minutes. To ensure the effectiveness and availability of ART, policy interventions should target establishment of more subsidized ART program for different countries of the world. It involves a comprehensive and individualized process, essentially focusing on physical, psychological, nutritional, and socio-supportive components of HIV/AIDS care. The lack of awareness and cost towards people with mental disorders is one area which needs to be addressed. The other is the attempt to reduce stigma through educational and community programs to increase acceptance and early detection. In conclusion, HIV is still a global health issue, though management of the disease has changed HIV to a chronic disease. The case study shows that early intervention, or rather bringing top-class good health care services, are crucial. Other issues, such as unfair or inequitable treatment for persons with mental illness and prejudice, continue to be observed. It is the role of the healthcare workers to fight for the change of practice by promoting human-centered, culturally sensitive care, being involved in creating awareness, and contributing to the conduct of research. These approaches are likely to form a foundation towards a society that is free from HIV and AIDS.
Good job, guys.
Good job.
So this concludes our presentation. Does anybody else have anything they wanted to say?
No.
Okay, so I'm going to be ending the video. Let me see. I'm going to stop the recording at this moment. Bye, guys. Thank you.
Bye.